Ovarian cysts treatments. Ovarian cysts are fluid-filled growths in a woman's ovaries. The development of an ovarian cyst may happen in just one or both of the ovaries. Usually ovarian cysts are harmless and will go away on their own, but sometimes ovarian cysts can become so large that they rupture, or cause damage to the ovary. Very large ovarian cysts can cause displacement of the reproductive organs. Damage from a ruptured ovarian cyst may cause scar tissue buildup, and/or the formation of adhesions, attaching the ovary to other parts of the internal body. Ovarian cysts are most common in women of childbearing years, but can rarely develop in postmenopausal women. A woman's ovaries are about the size and shape of an almond. It is amazing that something so small and delicate can hold thousands of eggs at birth. It is also quite amazing that something so small can develop a cyst. Thankfully, there are natural remedies that can help the body to rid itself of the cysts naturally, without surgery. Types of ovarian cysts. Functional ovarian cysts. A woman's ovaries contain thousands of follicles that house immature eggs, ovum. During the menstrual cycle each month, as ovulation nears, a select number of follicles are signaled to grow, mature, for ovulation. An ovarian cyst that forms due to a malfunction in follicle maturation is known as a functional cyst. There are two types of functional cysts. Follicular cyst. This happens when the follicle fails to rupture and release the egg at ovulation. Instead it continues to grow, forming a cyst. Corpus luteum cyst. After ovulation, once the egg is released, the follicle changes to what is called the corpus luteum. The development of a corpus luteum cyst happens when the opening in the follicle where the egg was released seals off and then causes the corpus luteum to accumulate fluid and grow into a cyst. Other types of ovarian cysts. There are other types of cysts that form on the ovaries, but they are not related to the menstrual cycle. Dermoid cyst. These cysts are considered complex and develop from cells that produce human eggs. Because of this, these types of cyst may contain hair, teeth, or skin. They are rarely cancerous. Cystadenomas. This type of cyst develops from ovarian tissue and is filled with liquid or mucus. Endometriomas. This type of cyst forms when displaced endometrial cells attach to the ovary and form a growth, endometriosis. This type of ovarian cyst is commonly called a chocolate cyst. Polycystic ovaries. A polycystic ovary develops many small cysts in a row, on the surface of the ovary, which looks like a strand of pearls. Polycystic ovaries are associated with polycystic ovarian syndrome, PCOS. In the case of polycystic ovaries, the ovaries may become enlarged, typically twice the size of normal ovaries. PCOS is fast becoming a leading endocrine disorder among women. Not all women diagnosed with PCOS have ovaries that have these types of cysts. What causes ovarian cysts? Irregular menstrual cycles. Hormonal imbalance. Hypothyroidism. Cigarette smoking. Early menstruation, 11 years or younger. BMI above 30. Infertility treatment with gonadotropins has been found to cause multiple large ovarian cysts in some women. Use of clomiphene, clomid, serafine, has been shown to increase the risk for development of corpus luteum cysts. Use of tamoxifen for breast cancer. Signs and symptoms of ovarian cysts. Most women that have ovarian cysts don't even know. Typically there are no signs or symptoms. Most ovarian cysts are discovered during a routine physical exam. The larger a cyst is, the more likely it is to cause symptoms. Symptoms may be pelvic pain, usually on the side where the cyst is present. Pain may be sharp, sudden or come and go throughout the cycle. Irregular menstrual cycles. Anovulatory cycles may be a sign of a follicular cyst. Charting your cycle can help you to determine if you are having anovulatory cycles. Pelvic pain after intercourse or strenuous exercise. Nausea and vomiting. This usually happens after a cyst ruptures. Vaginal pain with spotty mid-cycle bleeding. Pressure and/or abdominal bloating may be noticeable on one side or the other. Pain or pressure in the abdomen when urinating or having a bowel movement. Infertility. Note: see a doctor immediately if you have excruciating pain, nausea, vomiting and/or bleeding from the vagina during any point in your cycle. How is ovarian cysts diagnosed? If you suspect you have an ovarian cyst, your doctor can help direct you to the best type of diagnostic testing for your needs. Here are some tests your doctor may perform. Endovaginal ultrasound is a vaginal ultrasound probe inserted into the vagina. This type of ultrasound has been found to produce a better image of ovarian cysts than external ultrasound through the abdominal wall. Laparoscopic surgery may be performed to determine the type of cyst and to take a biopsy. CT or MRI may be used if there is further concern. Serum CA-125 assay is a blood test to determine if the cyst is cancerous. This test is not always accurate because elevated levels of CA-125 may also signal the presence of uterine fibroids, adenomyosis or endometriosis. Medical options for ovarian cyst treatment. The number one medical treatment for functional ovarian cysts is to prescribe birth control pills. This prevents ovulation, therefore the formation of functional ovarian cysts cannot happen. Use of the birth control pill presents a problem though. 1. It prevents pregnancy, and 2. It may cause long-term hormonal imbalance, and 3. It does not solve the root of the problem. If an ovarian cyst becomes too large, is considered to be at a higher risk for rupture, is a complex cyst, has twisted or has become attached to other parts of the internal body, a doctor may choose to remove it surgically. Your doctor will be able to help you to determine your best options. How natural therapies may help with ovarian cysts. There are natural options that are very effective for managing functional ovarian cysts. We like to approach it at two different levels, clearing out and prevention. In this guide you will learn how to clear out excess estrogens and cysts while working to prevent future ones from being created. This therapy usually has results in 3 months, but should only be done prior to trying to conceive. The benefits of natural therapies for ovarian cysts. Reduces excess estrogens. Promotes hormonal balance. Reduces cyst size and growth. Least invasive. Very effective. No side effects. How to help ovarian cysts naturally. Step 1. Reduce estrogen. Excess estrogen is one of the most common types of hormonal imbalance which can cause the disruption of ovulation. One of the best ways to rid the body of excess estrogens is to stop exposing yourself to XANA hormones and to start taking a supplement called DIM, dindylmethane. Avoid exposure to estrogens and xenoestrogens. Stop eating soy foods. Eat only organic meats and dairy. Do not microwave foods in plastic. Stop drinking water from plastic bottles. Avoid mineral oil and parabens in skincare products. Use natural detergents. Supplement with DIM. DIM helps to clear the body of these excess estrogens, aiding in hormonal balance and reducing the promotion of ovarian cyst growth. DIM should be taken daily for at least 3 months along with lifestyle changes which include avoiding xenoestrogens found in products, foods and the environment. Step 2. Increase progesterone and balance hormones. Natural progesterone. When there is excess estrogen in the body, there is usually also a progesterone deficiency. Balancing your estrogen and progesterone levels by using natural progesterone cream will help reduce the ovarian cysts and the chance of them occurring in the future. Use of natural progesterone cream helps to increase progesterone levels. Supportive herbs for ovarian cysts. Now that clearing out is covered, let's look at balancing the body so we can help prevent future cysts. Consider an herbal program for preventing ovarian cysts from forming in the first place. We like to use herbs to help to nourish the endocrine system, promote hormonal balance, regular ovulation, and proper circulation to the reproductive organs. We also like to use herbs that are detoxifying to the liver for improved hormonal balance and estrogen metabolism. Step 3. Dissolve and reduce cysts. There are 2 natural therapies that have been used time and time again to help the body break down the cysts, reduce their size and may help them to disappear altogether. Systemic enzyme therapy. The body contains a variety of enzymes. Enzymes are catalysts for chemical reactions necessary to the innumerable actions that maintain the function of the body. A subclass of enzymes known as systemic enzymes work to help the body break down excess foreign tissues and reduce inflammation. Castor oil pack. Castor oil packs are an ancient therapy that helps to cleanse and heal the area of the body where they are placed. The castor oil has a drawing power that helps the body to clear itself of excess tissues and toxins. Castor oil packs stimulate the lymphatic and circulatory systems. The lymphatic system removes toxins and waste from the area where the pack is applied. Thanks for watching. Hopefully we give you some valuable information. If you're really suffering these type of problems and feeling shy to go doctor's place, then you can try a product which is given in top of description. And you can watch the review video which is now in front of you on screen. Thanks for your attention. If you think this video is useful, then please subscribe to inspire us. All the best.